Tamara Maddie recording my head-to-toe assessment for Maryville University. This is Kenny volunteered to be my patient today. Before he came in, we had him empty his bladder, did vital signs on him, and height and weight, and explained what type of exam that we were going to be doing today, which entails the head-to-toe assessment. So I'm first going to inspect the face, look at the eyes, the symmetry, look at the skin on the head, make sure there's no lesions, redness, palpate the scalp to feel for any masses, touch the hair to make sure, to feel if it's coarse or thick. I'm going to then have the patient close his eyes very tight, close them tight, okay? Then go ahead and open them wide, okay? Wrinkle your forehead, and show me, then go ahead and clench your teeth, okay? And then just smile normal, smile, and then stick out your tongue, and then puff out your cheek. Okay, I'm also going to just have you close your eyes for a minute and tell me if you feel me touch you and if it feels the same.
Yeah. Same.
Okay, I'm also going to have you with your eyes closed. I'm using an instrument here, and have you tell me if you feel that it's sharp or soft, okay?
Sharp, soft, sharp, soft, soft, soft.
Okay, you can go ahead and open your eyes. Next, I'm going to look at his eyes, and or I'm actually going to palpate the facial structure, making sure that everything feels smooth, and the bones, there's no noted lesions or rashes, masses. I'm going to feel for the temporal mandible joint. Go ahead and open your mouth and close. Okay, any problems there? Okay, that all looks good. I'm then going to look at his eyes and note that the eyelids and the eyelashes are pointing up and outward. I'm going to look at the sclera and the conjunctivae, which the sclera is nice and pink, no redness. Conjunctiva is nice and white. I'm going to palpate the sinus region, the frontal, and the maxillary. And is there any pain with me pushing there? Okay. I'm then going to have you look straight forward. I'm going to look at the pupillary responses. We're going to do direct and indirect. You got to keep them open. Okay, and those look good there. I am going to check the red reflex. Okay, just keep looking forward there. Okay, and that is good on that side. And we'll check on the other. And that's good there too. Okay, I'm going to check for any extra intraocular movement with his eyes. I'm going to just have you follow your eyes, or follow the pen with your eyes, just don't move your head, okay? Okay, and that looks good. No nystagmus noted on that exam there. I'm going to go ahead and look at the ears, and that looks even, symmetrical, which is nice and pink. I don't notice any lesions or masses on the pinna area. And then I'm going to go ahead and look at the tympanic membrane. And that looks good on that side. It's nice and pearly gray. No redness or bulging noted. Pulling the ear up and back. And that looks good as well. Okay, I'm also going to assess his hearing. I'm first going to do the whisper test. Just repeat after me.
99. 99.
Okay, and that's good. And then we're going to do the Weber test and the Renna test. We'll first start with the Weber test. Go ahead and just let me know when you hear this stop.
Stop.
Okay, and then we'll do the Renna test, which measures bone versus air conduction. Let me know when you hear it stop.
Stop.
And
Stop.
okay, and we'll do the same on the other side. And when you hear that stop.
Stop.
And
Stop.
okay, and that all is good there. Next, I'm going to inspect the nose and make sure that the nose is in line. There's no deviation in his septum. I'm going to look at the terminus and make sure that there's no redness or any lesions noted. Just tilt your head back. They both look good there. I'll go ahead and check the patency of each nostril. Just take a breath in. And one more. Okay, and that is good there. I also forgot to palpate the lacrimal apparatus around his eyes, which is all good. Nothing noted there. Soft, no lesions, puffiness. Then I'm going to look at his lips, check the lips for any fissures or cracks, any lesions or masses. Go ahead and open your mouth for me. Looking at the teeth, making sure there's no extra redness in the gums, which they all look pink and moist. If you can move your tongue to the right, okay, and then to the left, and that looks good there. Checking the soft and hard palate, looking at the uvula, the pillars, the tonsils. Okay, stick your tongue out for me. I'm going to check the gag reflex and the test to make sure that his uvula is moving symmetrically. Go ahead and stick your tongue out. And that all moves good. No excess redness or swelling noticed in the mouth area. Okay. I'm then going to palpate the lymph the pre-auricle, the post-auricle, the occipital, the tonsillar, the submental, the submandibular, the superficial cervical chain, the posterior cervical chain, the deep cervical chain, and the subclavicular cervical chain. Can you lift your arms out to the side? We're going to check the intra-cervical chain and then the axillary. And no swelling noticed on any of the lymph nodes there. Next, I'm going to have you shrug your shoulders for me. Okay, and do. And then test for range of motion, passive and active. Go ahead and try to push up against my hand. Okay, and then have your arms come out there, and then don't let me push them down. And then, okay, perfect. And then put them to the side. And then the same thing, I'm going to try to push them down. And then, okay, good. I'm going to inspect the chest here and note the chest hair and moles. Also looking at the arms, noting the hair on the arms, which looks even. Color of his skin. Looking at the fingertips here, looking for any cyanosis or clubbing, checking capillary refill, which is good, all less than 2 seconds. I'm then going to palpate the carotid. And that is even and normal rate. And then I'm going to look at the trachea and make sure that it is midline, there's no deviation there, and try to palpate the thyroid, if you could swallow for me. Okay, and that all feels good. I'm going to go ahead and listen to the carotids and the thyroid with the bell of my stethoscope. Make sure I'm not hearing any extra sounds, such as brewing. Okay, and that feels good as well. I'm also going to check the pulses, brachial pulses and the radial pulses as well. And those are even, and then the radial pulses. And those are good as well. Next, I'm going to have you slide around to the side here. And I'm just going to look at the chest wall, the posterior, and the back and the thoracic area, and then looking for any moles, lesions, rashes, anything like that. I'm going to go ahead and check to make sure that when he's breathing, it's symmetrical. If you could go ahead and take a breath in and out. Okay, and that feels even as well. I'm going to percuss for the diaphragmatic excursion, which should be between about 3 and 5 centimeters. Go ahead and cross your arms in the front, and then take a breath in and a breath out. And I'm going to mark that about there, and then go ahead and do the same thing, breath in and out. So that is approximately 3.5 centimeters there. Okay, and I'm gonna, I would do do that on the opposite side as well. Now I'm going to, you can put your arms down here. Now I'm going to try to palpate and feel for the kidneys and check for the costovertebral angle. And just let me know if you feel any pain here. Any pain?
No.
Okay. And then I'm going to auscultate the lungs symmetrically and systematically. Take a breath in and out. In and out. And in and out. And in and out. And in and out. In and out. And in and out. And again. And out. Okay, and then I'm also going to check tactile fremitus. I'm just going to have you repeat the word 99 as I go down your back. Okay, go ahead. 99,
99,
99,
99,
and 99.
99.
Okay, and that is even in vibration there as well. And I'm also going to listen laterally to the lungs. You could just, yep, and take a breath in and out, and in and out, and in and out. Okay, and then I'm going to listen to you on the other side. Okay, and that all sounds good there. I'm then going to have you turn around this way, and I'm going to listen to the lung fields on the front, the anterior chest. Go ahead. And that all sounds clear and bilaterally, both anterior, posterior, and laterally. Next, I'm going to go ahead and have you lay back on the bed for me. Okay. And I'm going to feel for the pericardium to see if there's any thrills or heaves or pulsation. And that feels good. And then also the apical pulse, which has no extra thrills. I'm also going to then auscultate the heart sounds and just breathe normal. And tricuspid, the Erb's point, and the mitral. And up here it was the aortic and the pulmonic. That sounds good. S1 and S2, no extra heart sounds heard or murmurs. I'm then going to, if you could just lift your head so I can look at your belly, okay, and then you can lay back down. I'm just looking here again for the muscle tone in the chest. I'm also looking and inspecting the skin to make sure that there's no lesions, rashes, and he does have good muscle tone in the belly. Next, I'm going to look and palpate the aortic, and just looking down the center of his chest. I'm going to palpate that. I'm then going to listen to all four quadrants of the belly. Good bowel sounds are heard. Over that, I'm going to, with the Bellamite stethoscope, listen to the aortic. Make sure there's no extra sounds. No bruise are heard. And then the renal arteries. The iliac. And then the femoral. Okay, then I'm going to do some percussion to find the liver borders. So I'm going to start up here. Okay, I'm going to mark that right there. And then I'm going to go from the bottom. And it's about right there, the liver borders, which is about anywhere between 5 to 8 centimeters, which that looks like it's about 6. I'm then going to try to percuss for the spleen. You're looking for the dullness here. And the spleen, and in general, people, you won't be able to feel it, but you do hear the dullness right there. I'm going to try to palpate the spleen, which I'm not able to do, and I'm going to try to palpate the liver, which on most people you shouldn't be able to feel, and then also palpate the kidney, right and left, which I am not able to do with that either. I'm going to then do some light palpation on the belly. Noting if the patient is guarding at all, and then move to deep palpation. Are you having any pain? Okay, and that all looks good. I'm then going to have you sit up, and I'm going to feel for the, I already checked the radial and brachial pulses. I'm going to feel for the popliteal pulses. The posterior tibius, and the dorsus pedis, which all have good pulses in them, even and regular. I'm then going to go ahead and check the reflexes. Go ahead and have you relax your arm here. And the radial reflexes all are good. And then we'll do the knee. And then the Achilles. Okay. And next I'm going to I looked at his legs as well and noticed the temperature of the extremities, looking at the hair on the legs, noting even hair growth, no edemas noted, coloration is good, normal for the patient, and next going to have the patient stand up and have you turn this way here, and I'm just going to look at the cervical spine and the lumbar spine, and just going to have you cross your arms there and just bend forward a little bit, and just noting that it looks no swaying, it's even, and then bend down a little bit more, and that the lumbar spine is also even as well. You can go ahead and have a seat.